you know that 20% of pediatric ER visits every year are due to complaints of fever? And did you know that most of the time you can take care of your child's fever safely at home? Hi, I'm Dr. Katie, just one of the double board certified pediatric emergency doctors behind Tiny Tots ER Docs. My friend Dr. Supriya and I are constantly getting phone calls and text messages from friends and family asking about common pediatric illnesses, and we get a lot on fever. What is a fever? How do I treat a fever? And when do I know if I need to go to the ER? Today, we are going to bring this hot topic to you. We're going to educate you on common topics surrounding fever and teach you when you should seek medical attention in person. If you like what you learn here today, you can click our YouTube channel here to subscribe. And you can follow us on Instagram, where we share daily tidbits on pediatric emergency topics. Remember, every child is special and different. So if your child is less than 3 months old, has an underlying medical condition, or is un or under vaccinated, this video may not be for you and you should seek medical attention with your pediatrician. Okay, let's dive into this hot topic of fever. So one of the main questions we get asked is, what is a fever? I've heard of low-grade fever and I've heard of high-grade fever, but what's the actual number I'm looking for? So fever is defined as anything above a normal base temperature, which we define as above 100.4 Fahrenheit or 38 degrees Celsius. The next question I get is, isn't fever bad for you? No, actually. Fever is the body's normal response to infection and inflammation. It's recognizing something that shouldn't be there in your body and saying, hey, get out. There are actually a lot of different things that cause fever, but there are 3 main culprits we should think about. First is viruses, like COVID and our old friend influenza. Bacteria, like most ear infections, urine infections, and strep throat. And then we have environmental factors, like sun exposure and heat exhaustion. But Dr. Katie, what happens if my child has a fever and something else, like a fever and a cough, or a fever and congestion? That's okay. There are a lot of normal symptoms that accompany a fever, such as feeling chills and shivers, feeling very sweaty. Some children will complain of headache, body aches. Some children will develop a rash that when you press on it, the rash goes away. Some children, especially toddlers and infants, will get really irritable and fussy. And these are all normal symptoms that can accompany a fever. But what if your child doesn't have any other symptoms? What if your child just has a fever? That's okay too, because as we know, illnesses progress over time. So if your child only has fever on day 1, they might develop other symptoms on day 2, 3, or 4 of illness, such as cough, congestion, or rash. So you feel your child's forehead and you think they may be hot, and you're wondering if they have a fever. But how do you take a temperature? It actually depends on the age of your child. So if you have a little baby, the most accurate way to check a temperature is with a rectal thermometer. You're going to take a dollop of your favorite lubricant and place it on the tip of the rectal thermometer. Then gently insert the tip of the rectal thermometer into your child's rectum. Wait till it beeps, and then you know an accurate temperature has been recorded. If you have a young child or a toddler, there are 3 ways that you can check the temperature. The first is by scanning the forehead. The second is by gently inserting it into the ear canal. And the third requires a different thermometer from your rectal thermometer, an oral thermometer, which you can also place right underneath the arm. All 3 will beep when a temperature has been accurately recorded. If you have an older child or an adolescent, the most accurate way to record a temperature is actually Okay, so you've established that your child has a fever. Great job on learning how to take that temperature. What do you do next? Well, check in with your child. See how they feel. Are they more irritable, fussy, maybe they don't want to eat, or does the temperature make you feel really uncomfortable? There are a few immediate measures that you can do to cool off your child. First, if you're in the comfort of your own home, think about taking all of your child's clothes off and allowing them to lounge around in a diaper or a pair of underwear. This will immediately allow them to cool off. Second, make sure your child is drinking enough fluids. This can be accomplished in a variety of ways. You can offer breast milk, water, Pedialyte, really any fluid that has a little bit of calories is a great option. Remember, kids sometimes have their taste buds thrown off and they don't have a true hunger for real food when they're sick, and that's okay. We just want to make sure they're staying hydrated. But how can you measure if they're staying hydrated? Check how much they're peeing. So if your kid is in diapers, are they making around the same number of wet diapers they do on a normal day? If they are, that's a good sign. If your child is making less than one wet diaper in 6 to 8 hours, that's concerning. What about toilet trained children? Is your toilet trained child going to the bathroom around the same number of times they would be on a regular day, or have they also not peed in 8 hours? That's concerning. Third, passive cooling measures. Take a washcloth, run it under some cool water, and then just gently dab it all over your child's body. This will allow the heat to dissipate off of your child and lower their body temperature. Or if your kid is like mine and is obsessed with bath time, you could give them a bath. Just make sure the water isn't too cold. We're going for lukewarm here. Remember, their skin is going to be very hot, and so if you give them a cool, cold bath, it's going to be very uncomfortable. Thirdly, who doesn't love a popsicle? And bonus, this is going to put a smile on your child's face. And lastly, remember, lots of rest and relaxation and snuggles. Your child might just want to hang out with you all day and watch TV, and that's okay. This might be a time where it's okay to loosen up the rules a little bit, allow your child that natural time, rest, and relaxation for their body to heal. But Dr. Katie, how do I know when I should medicate my kid? I tried all of your passive cooling measures, my child is still fussy, and the temperature is still high. I hear this all the time from parents, friends, and family. And you know what? I've been there myself. Fever can be really scary and really uncomfortable when the fever doesn't calm down, despite everything that you're doing. So let's talk about fever-reducing medications. There are two main fever-reducing medications on the market. They are active ingredients, acetaminophen, commonly marketed as Tylenol, and ibuprofen, commonly marketed as Motrin. Acetaminophen and ibuprofen are the active ingredients, so it doesn't matter what brand you buy. They all have the same formulation. Both of these medications are weight-based, so make sure to check with your healthcare provider on the appropriate weight-based dosing for your child. Or if you know your child's weight, you can check out our free fever guide here for an appropriate weight-based dosing. So how do I medicate my children? I check their temperature. If their fever is above 100.4 Fahrenheit or 38 degrees Celsius, I give them one medication. Set the initial time as hour 0 and give one medication, such as acetaminophen, and then remeasure the temperature in 3 hours. If in 3 hours your child still has a fever, give the second medication, say ibuprofen. Then recheck the fever again in 3 hours. If your child still has a fever recorded as above 100.4 Fahrenheit or 38 degrees Celsius, give the initial first medication again. In this case, it would be acetaminophen. And then check your child's fever again in 3 hours. If they are still having a fever at that time, you can give the second medication again. In this case, that would be ibuprofen. By giving your child medication in 3-hour intervals, you are able to have a medication on board your child every 3 hours to help control fever. I also give my medication in a measured syringe, usually with a little tip, because I have a baby. This is great for babies and infants who don't want to necessarily take medication. A little trick is put it in the side of their cheek and give small doses of their entire dose. So say your child's dose is 5 mLs, I would give it 1 ml by 1 ml by 1 ml by 1 ml by 1 ml. This way you know how much the baby is getting, just in case they spit up or vomit. Okay, so we've covered a lot of topics today. What is a fever? What causes fever? What are some normal symptoms that can accompany fever? How do I check for a temperature? And how can I treat fever at home? But what happens if your child continues to have a fever, and when should you seek medical attention in person? Remember, if your child is less than 3 months of age, has an underlying medical condition, or is un or under vaccinated, you should think about talking to your healthcare provider right away. If your child falls into a different category, there are several signs and symptoms that you should look out for that should prompt you to seek medical attention in person. These include fever for more than 5 days, signs of dehydration. This can include eyes being sunken, very dry lips and or dry mouth, or decreased urination. Difficulty breathing. If your child is struggling to breathe, or is breathing rapidly, or is using their stomach or their ribs to breathe, and you can see their ribs or their clavicle, that means your child is having trouble breathing. If your child is complaining of a stiff neck along with headache, or if your child is tripoding and not moving their neck at all, that should be concerning. If your child develops a rash with fever that when you press on it, the rash does not go away, or it looks very purple in nature, if your child has a seizure along with fever, you should call 911. Whether or not it's a first-time seizure or your child has an underlying seizure disorder, if your child is having persistent vomiting and diarrhea and you're not able to get any fluids into them and you feel like they're dehydrated, if your child becomes altered in any way, if your child goes limp, becomes unresponsive, is not answering questions appropriately, or is excessively lethargic, especially in an infant, seek medical attention. We really hope you learned something here today about fever. It's a topic that is near and dear to both of our hearts because we teach it every day to parents in the ER, and we live it because we have kids who get fevers. We know that it can be scary. So hopefully you learned how to take care of your sick child at home and when to seek medical attention in person. If you like what you heard here today, you can subscribe to our YouTube channel and you can follow us on Instagram. Okay, see you next time.